Welcome to Chapter 6A. Over the next 2 weeks, we are going to be exploring the topics of sexual health. And so this week is understanding your sexuality. And we're going to explore sexuality starting with the time of conception when our sexual identity begins. We're going to explore how social constructs and gender roles play an instrumental role in how we express sexuality. We're going to look at biological, physiological, psychological, and social determinants of our sexuality and the functions of the male and female reproductive anatomy. We're also going to look at stages of human sexual responses and the options available for expressing sexuality. Your sexual identity is recognition of oneself as a sexual being. It's determined by a complex interaction of factors. The combination of sex assigned at birth, the gender the person identifies as, and who the person is attracted to, both physically and emotionally. The beginning of sexual identity begins at conception with the combination of chromosomes that determine sex. All eggs carry an X chromosome. The sperm carries the X or Y. Females are XX, males are XY. So the genetic instructions included in the sex chromosomes lead to the differential development of female and male gonads, the reproductive organs, at about the 8th week of fetal life. Sometimes chromosomes are added, sometimes they're lost or rearranged in this process, and the sex of the baby is not clear, a condition known as intersexuality. It used to be called, way back when, hermaphrodite, but now it's intersexuality because they're seeing that there are so many more combinations, and it's much more common than people realize. So I believe the statistic is 1 in 6 children are born intersexed, and you have about as much likelihood as being intersexed as you are being born with red hair. My sister was born with red hair. So male gonads are the testes, female gonads are the ovaries. The primary female sex hormones are estrogen and progesterone. Then primary male are testosterone. At the time of puberty, sex hormones, again, play major roles in development. Hormones released by the pituitary gland, called gonadotropins, stimulate the testes and the ovaries to make appropriate sex hormones. The increase of estrogen production in females and testosterone production in males leads to the development of the secondary sex characteristics like vocal pitch, body hair, and location of fat deposits. Yep, even our fat deposits are determined by sex. Gender refers to characteristics and actions typically associated with men or women, masculine or feminine, as defined by the culture in which one lives. Our sense of masculine and feminine traits is largely a result of socializing during our childhood. Gender roles are the behaviors and activities we use to express our masculinity or femininity in ways that conform to society's expectations. Gender role stereotypes can make it difficult to express one's own sexuality. Androgyny is a combination of both masculine and feminine traits in a single person. Gender identity is a person's sense of awareness of being masculine or feminine. It's truly actually a spectrum, right? There are some females that are really, really female, really, really girly, and there's some masculines that have the machismo that are extra masculine, right? And somewhere in between, is where we all lie. A person whose gender identity does not match his or her biological sex assigned at birth is said to be transgender. When a person's gender identity matches the sex assigned at birth, the person is cisgender. Sexual orientation refers to a person's enduring emotional, romantic, or sexual attraction to others. A person may be primarily attracted to a member of the opposite sex, which is heterosexual, the same sex homosexual, or both sexes bisexual. What I am going to tell you is that this description here of sexual orientation is very brief. There is a host of others that we could dive into, but we're just kind of scratching the surface here to develop some awareness. So there's pansexual, sexual, omnisexual, demisexual, monosexual, asexual. Being mindful that just because this is all you have been introduced to doesn't mean that that is all that there is. So be willing to expand, to reduce our own sexual prejudices, which refers to negative attitudes and hostile actions directed at a societal group and its members. Often hate crimes happen against individuals that don't fit in with societal norms. But I think this is starting to truly change, and I've seen a lot even in my lifetime, thank goodness. And I think that we're going to see actually a lot more as well. I appreciate this short video just so that we can break down some of the definitions, do's and don'ts. So I think gender dysphoria is worth taking a note of. And it's truly a disconnect from what you feel that you physically are and what everybody else, the whole world, is telling you you should be. So It's truly a thing, and I've worked with clients who experience gender dysphoria, and it causes a lot of mental and emotional disturbances. So let's not ever discredit anybody else's identity and label them as something that they're not. I think if we're going to be talking about human sexuality, it's only right that we talk about their reproductive anatomy and physiology. And understanding the functions of male and female reproductive systems are really going to help to derive pleasure and satisfaction from sexual relationships, be sensitive to your partner's wants and needs, and make responsible choices regarding your sexual health. So the female reproductive anatomy, the system includes two major groups of structures, the external genitals and the internal organs. External female genitals are collectively known as the vulva and includes all structures that are outwardly visible. The mons pubis is a pad of fatty tissue covering and protecting the pubic bone. The labia majora are folds of skin and erectile tissue that enclose the vaginal and urethral openings. The labia minora are folds of mucous membranes. The clitoris is located at the upper end of the labia minora and beneath the mons pubis, and its only known function is sexual pleasure. The urethral opening is right below the clitoris. The vaginal opening may be covered by a thin membrane known as the hymen. The internal female genitals include the vagina, which is the passageway from the uterus to the outside of the body. The uterus womb is a hollow, muscular, pear-shaped organ. The endometrium is the lining of the uterus. The cervix is the lower end of the uterus. The ovaries produce estrogen and progesterone and house immature eggs. And the fallopian tubes capture the eggs as they are released from the ovaries during ovulation. And that's the site where sperm and egg meet and fertilization takes place. It's remarkable to me that not many people truly know the structure of their own reproductive system. With the onset of puberty, the female reproductive system matures, and the development of secondary sex characteristics transform young girls into women. And about age 9.5 to 11.5, the hypothalamus receives a message to begin secreting gonadotropin releasing hormone. The release of that hormone signals a pituitary gland to release gonadotropin hormones, especially follicle-stimulating hormone and luteinizing hormone, which signal the ovaries to start producing estrogen and progesterone. Estrogen regulates the menstrual cycle, and progesterone helps the endometrium to develop in preparation to nourish and fertilize eggs, and helps maintain pregnancy. The normal age range for the first onset of the menstrual period, termed menarche, is 10 to 18, 9 to 18, somewhere around there, with the average being 12 to 13 years old. The average menstrual cycle lasts 28 days and consists of 3 phases: the proliferative, secretory, and menstrual phases. There are also menstrual problems. PMS, premenstrual syndrome, it's a collection of physical, emotional, and behavior symptoms that many women experience 7 to 14 days prior to menstruation. PMDD, premenstrual dysphoric disorder, includes severe depression, hopelessness, anger, anxiety, low self-esteem, difficulty concentrating, irritability, and tension. Dysmenorrhea is a medical term for menstrual cramps, typically more severe cramps. There is some cramping that is normal, but there's also more severe. And then there's TSS, toxic shock syndrome. It's pretty rare today, but it's still something that women should be aware of. And it's caused by bacterial infection facilitated by the use of tampons, diaphragm, or any contraceptive that is inserted. There are other menstrual problems as well, but these are just typically the most common. Another one that is notable is endometriosis, and that's part of the lining of the uterus. Detaches and attaches itself to other organs in the body, and you also during menstruation bleed from that point as well. Here is a quick diagram of the 3 phases of the menstrual cycle. So the proliferative phase happens right after menstruation occurs, and this is where the hypothalamus senses that the low blood levels of estrogen and progesterone, and it starts to increase the secretion of that gonadotropins, which triggers the pituitary gland to release their hormones coming in this way. Here is this little red spot is the time when ovulation can occur, or when ovulation does occur. And after which the secretory phase comes in, and if the egg has not been implanted, this is where begin the endometrium begins to thicken, secreting the blood, holding on to the blood, storing, and then when it recognizes that the egg has not been fertilized, menstruation begins, and then the phase starts all over again. That was in much simpler terms than saying all of the big hormone names over and over. So women, we are not done. Once we get through our menstruation years, we get to step into menopause. And it's a permanent cessation of the menstruation. It generally occurs after the age of 45, somewhere between 40 and 60. Perimenopause refers to the 4 to 6 years preceding menopause. Yep, it's like an infomercial, but wait, there's more. So that's when hormonal changes begin to start taking place, and menstrual cycle and flow becomes pretty irregular. Menopausal changes result in decreased estrogen levels, causing symptoms such as decreased vaginal lubrication, hot flashes, night sweats, headaches, dizziness, and joint pain. There's a host of other symptoms that go along with it too, but that's an entirely another class. There are synthetic forms of estrogen and progesterone, which have been prescribed as hormone replacement therapy, and also known as menopausal hormone therapy. Doctors only prescribe HRT in severe cases, and when a woman meets a number of criteria, including being free of heart disease, diabetes, and a history of breast, ovarian, and uterine cancers, may they step into HRT. So we just keep having more and more to look forward to. The male reproductive system is also divided into internal organs and external anatomy. The penis and scrotum make up the external genitalia, and the penis is a male organ through which urine and semen are expelled through the body. Ejaculation expels the semen through the urethra and out the penis. The scrotum serves to control temperature and protects the testes, which manufacture sperm and testosterone. The internal genitalia include many organs and glands. The testes are responsible for manufacturing sperm and for producing testosterone. Spermatogenesis is the development of sperm. The vasa deferentia serve to store and move sperm. Seminal vesicles provide sperm with nutrients and other fluids that compose semen. The prostate gland adds chemicals to semen to help neutralize vaginal fluids. Women's vagina is very acidic. The The Cowper's gland secrete a fluid that lubricates the urethra and neutralizes acid. A small valve in the prostate gland prevents urine and semen from ever passing through the urethra at the same time. The American Academy of Pediatrics and the CDC counsel that the benefits of newborn male circumcision outweigh the risks, but the benefits are not great enough for routine circumcision to be recommended for infants. So you can see the difference between circumcised and uncircumcised, and it's really just a matter of foreskin. The human sexual response generally follows a specific pattern. Both males and females exhibit 4 common stages. The excitement or arousal stage, where vasocongestion occurs, the vagina lubricates, the penis becomes erect, and you may experience a sex flush that comes over you. The plateau phase is characterized by the intensification of initial responses. Orgasmic phase, when vasocongestion and muscle tensions reach their peak and rhythmic contractions occur throughout the genital regions. And the resolution phase, the organs return to their pre-arousal states, and a person experiences profound relaxation and deep feelings of well-being. Men and women experience the same stages, but length of time spent in any one stage varies. In males, the refractory period is the time it takes before subsequent arousal can occur. The reproductive system, like other body systems, can malfunction. Sexual dysfunction is the term used to describe problems that can hinder sexual functioning. Common causes of sexual dysfunction can include, but are not limited to, biological or medical factors, substance-induced factors, psychological factors, and factors related to social context. Sexual dysfunction can be divided into 4 major categories: desire disorders, arousal disorders, orgasmic disorders, and pain disorders. So within desire disorders, there's a lack of interest in sexual activity, could be experiencing phobias, fears, or anxiety about sexual contact. Arousal disorders, inability to achieve or maintain an erection, inability to remain sexually aroused. Orgasmic disorders, reaching orgasm rapidly or prematurely, difficulty reaching orgasm despite normal desire and stimulation, inability to have an orgasm or difficulty or delay in reaching an orgasm. Pain disorders are identified by pain during or after sex. That's not normal. Forceful contraction of the vaginal muscles that prevents penetration from occurring. So those are the 4 main categories of sexual dysfunction. Every society sets standards and attempts to normalize sexual behavior. So rather than using societal judgment on what is normal, ask yourself some of the following questions. Is a sexual behavior healthy and fulfilling for a particular person? Is it safe? Does it lead to the exploitation of others? Does it take place between responsible, consenting adults? Instead of making blanket judgments, we might consider the SERTS model for healthy sexuality. Consent, equality, respect, safety, and trust. There are options for sexual expression. Celibacy and abstinence is the abstination from all sexual activities whatsoever, including masturbation. Abstinence is the avoidance of intercourse, oral, vaginal, or anal. Autoerotic behaviors involve sexual self-stimulation, and such as sexual fantasies and masturbation. Sexual fantasies are sexually arousing thoughts and dreams, and masturbation, as we know, is self-stimulation of the genitals. There's kissing and erotic touching. Stimulation of erogenous zones can lead to sexual arousal. Manual stimulation is sexual arousal and orgasm through use of the hand or sex toys rather than through intercourse. Oral genital stimulation, cunnilingus, refers to oral stimulation of a woman's genitals, and fellatio is the oral stimulation of a male's genitalia. HIV and other sexually transmitted infections, STIs, can be transmitted via unprotected oral genital sex. We're going to talk more about that in our next chapter. Vaginal intercourse is the insertion of the penis into the vagina. It can involve a variety of positions. Protection from unintended pregnancy and STIs is essential. Again, we're going to talk about that next chapter. Anal intercourse is the insertion of the penis into the anus. Condom use is especially important. The delicate tissues of the anus are more likely to tear than vaginal tissues, increasing the risk of transmission of HIV and other STIs. So you're at greater risk with anal intercourse. Variant sexual behaviors are less common sexual activities that are considered outside the norm. They are legal when they involve consenting adults. Examples include group sex, swinging or partner swapping, fetishism, using inanimate objects to heighten sexual arousal, BDSM, bondage, discipline, domination, submission, sadism, masochism. Some variant behaviors can be harmful to the individual, to others, or to both, and are illegal in most circumstances. Exhibitionism is the exposure of one's genitals to strangers in public places. Voyeurism, observing other people for sexual gratification without their consent. And pedophilia, any sexual activity involving a minor. Any. Alcohol and drugs do more harm than good to sexual behavior. You hear a lot of people like, ooh, I'm getting loose, I'm getting in the mood. Well, for men, that can often lead to inhibit sexual responses. The mind may be willing, but the body may not be willing. When male erectile dysfunction drugs like Viagra are used incorrectly, and they're combined with alcohol and other drugs, they can cause a sudden drop in blood pressure and possible cardiac arrest, a heart attack. Date rape drugs are a growing concern on college campuses where they're often combined with alcohol. When you're combining, and we'll talk about this in another chapter, when we're combining any two substances together, it heightens the effect of both substances. Good sex should not depend on chemical substances, right? Don't depend on these substances to get you in the mood. If you can't get there without it, you probably shouldn't be doing it. Healthy and responsible sexuality includes good communication as a foundation. Acknowledging that you are a sexual being. We're humans. As humans, we are sexual beings. Understanding sexual functions and safety, and accepting and embracing your gender identity and your sexual orientation. Now that we know better, maybe we can do a little better. I'm so excited for our conversation in class this week. Until then, take care of you and be well.